Bismillah ar-Rahman ar-Rahim. Dear students, in this lecture, inshallah, we study anatomy of the liver and the biliary system. We start by the liver. Liver is the largest organ in the body, largest organ in our body. Position of the liver mainly in right hypochondrium, extended to epigastric region, reach up to left hypochondrium. Right hypochondrium, epigastric, extended up to left hypochondrium. This is the position of the liver. Surface anatomy of the liver. Usually we study the surface anatomy in any organ in a diagram. Surface anatomy must be studied in diagram. This diagram for surface anatomy of the liver. Liver, this is the liver. It is triangular in shape. We study the upper border of the liver, then the lower border of the liver, and right border of the liver. The upper border of the liver, point A, B, C, D. Point A, present in the fifth intercostal space. Fifth intercostal space. This is a point in a left midclavicular line. Actually, this is a point of the apex of the heart. The apex of the heart above and the liver below, separated by diaphragm. This is a point A. Point B, present 6 costal cartilage on the right side of the sternum with attachment of the sternum. Point C, again in the fifth intercostal space, right side, with the midclavicular line, Point D, present in mid-axillary line, in mid right side, mid-axillary, at 7 or 8 rib. 7 or 8 ribs, the same. This is the upper border. This is the upper border of the liver. Lower border of the liver. Lower border of the liver also begin by point A, B, C, D, E. Point A is the same. Point A, the fifth intercostal space, left midclavicular line, 3.5 inch from median belly. Point B, this is the costal margin, left costal margin, and this is the right costal margin. Present at the costal margin. Point B, left costal margin, at the junction with rib number 8. It's rib, it's costal cartilage. Point C, crossing of midline with transpyloric blade. By crossing midline and transpyloric blade. Point D, again in the costal margin of the right side. Point D on the right costal margin with the junction of ninth costal cartilage. Point E in mid axillary line, half an inch half an inch below costal margin. This is the lower border. Right border between point D and point E. This is the right border. This is the surface anatomy of the liver. Surface anatomy of the liver. Lobes of the liver. This diagram, the liver from the anterior surface, front, and this diagram from the back. In the front, between a right lobe and the left lobe, there are folds of peritoneum called the falciform ligament, which divides the liver from the front to the right and the left. From the back, there are fissure for ligamentum venosum, fissure for ligamentum teres. This is the right lobe, and this is the left lobe. Small lobe present here, and another small lobe also present here. These two lobes related to the right lobe. This lobe called caudate lobe, and this lobe called quadrate lobe. From this diagram, caudate lobe and the quadrate lobe related to the right lobe. So anatomically, the liver divided into right and the left lobe. Caudate and the quadrate lobe related to anatomically to the right lobe. But physiologically, the function of the caudate and the quadrate lobe related to the left lobe. So we can divide the liver into anatomical lobes and physiological lobe, physiological functional. Anatomically, right and the left lobe and the caudate quadrate related to the right lobe. Physiologically or functionally, caudate and the quadrate lobe related to the left lobe. This is anatomical and physiological lobe. Third classifications called surgical lobes. Surgical lobes is very important for the surgical anatomy for postgraduate, not for undergraduate. The liver divided into 10 segments or 10 lobes, 10 surgical lobes. Lobes of the liver. This is the right lobe and this is the left lobe from the front, separated by falciform ligament. From the back, this fissure for ligamentum venosum or fissure for ligamentum teres, and this is caudate lobe and this is quadrate lobe. Caudate lobe and the quadrate lobe. Anatomically, the caudate and quadrate lobe related to the right lobe. But physiologically, caudate and the quadrate lobe related to the left lobe. Surgical lobes of the liver divided into 10 segments called surgical lobes of the liver. It's very important for surgery. Here, surgical lobes, we can make line and attachment of falciform ligament and another line from the groove in front of the cava to the tip of the gallbladder, and horizontal lines. This line divides the liver into surgical loops, left superior segment or segment, left inferior segment, medial superior segment, medial inferior segment, anterior superior segment, anterior inferior segment, posterior superior segment, and posterior inferior segment. This is surgical segment or surgical loops of the liver. Oh, like this segmentation of the liver, surgical loops of the liver. Sorry, I don't have liver now. Suppose this is the liver. The liver like this have anterior surface of the liver, superior surface of the liver, posterior surface of the liver, and inferior surface of the liver. Also, liver have borders. Only the inferior surface of the liver is sharp border, but other borders are rounded, ill-defined. In the diagram, this is the anterior surface of the liver from the front, from above superior surface, and from the back posterior, and this is from the back of the inferior surface. And this is upper border, inferior border is a sharp border, and this is a right border. This is the liver. Morphology of the liver. The best method to study the morphology of the liver or any organs in practical lab. So, to know the details of surfaces and borders in the practical lab. Surfaces and borders of the liver. The liver have 5 surfaces. Right lateral, like in this direction, this is right lateral or the base. Anterior surface from the front, this anterior surface from the front here. Superior surface from above, posterior surface from the back, and inferior surface. The borders are ill-defined except the inferior border, which is a sharp border separating anterior surface from the base and the inferior or visceral surface, inferior surface or visceral surface. Ligaments of the liver. Liver have what is called peritoneal ligament related to the peritoneum, and the non-peritoneal ligaments. The ligaments of the liver transferred into peritoneal ligament and the non-peritoneal ligament. What is the peritoneal ligament? Remember, again, this is the liver. From the front, from between a right and left loop, there are ligament called the falciform ligament. This peritoneal ligament discussed in details in a lecture of peritoneum. Falciform ligament. Also, the peritoneum covers the liver from the front and from the back. Another peritoneal ligament, remember, the peritoneum covers the liver from the front and from the back, and the peritoneum reflected like this, reflection of the peritoneum like this, and the reflection like this, leaving area non-covered with peritoneum called the bare area. At the reflection, this is a ligament, and this is a ligament. This reflection of ligament, this and this which is surrounding bare area called the coronary ligament. The position of the liver like this. So this layer called upper coronary ligament, and this is called lower coronary ligament. This is the position of the liver. Upper coronary and lower coronary. Also, the peritoneum surrounds the liver from the front like this. Extension from this area from the side to the left side and extension to the right side ligament called right triangular and left triangular like this. يبقى البروتونيوم covering the liver and the reflection in the right side and the left side called left triangular ligament and the right triangular ligament. يبقى two coronary ligament و two triangular ligament and falciform ligament. البروتونيال ligament number 1 falciform ligament which separate the right lobe and the left lobe from the front. Number 2 coronary ligaments, 2 upper coronary and lower coronary which is surrounding their area. Number 3 triangular ligament, right triangular and left triangular. 2 coronary and 2 triangular. Number 4 lesser omentum. Lesser omentum is a ligament for stomach and liver. Remember, in a lecture of the stomach, suppose this is the stomach, duodenum, and this is the liver. Ligament connect liver with the stomach called the lesser omentum. Lesser omentum is a peritoneal ligament attached to the Porta hepatis and the fissure for ligamentum venosum and attached to the lesser curvature of the stomach. This is a peritoneal ligament. Peritoneal ligament, 6 ligament, 2 triangular, and 2 coronary, this is 4. Number falciform and lesser omentum. Non-peritoneal ligament. There are 2 non-peritoneal ligaments called ligamentum teres and another ligament called ligamentum venosum. Ligamentum teres in the embryology, this was vein in fetal circulation. Remember, in fetal circulation in general embryology, left umbilical vein. The left umbilical vein obliterated and become a ligament. After obliteration of this vein, become ligament and called ligamentum teres, which run in the falciform ligament. The ligamentum teres present inside the falciform ligament. Ligamentum teres. Ligamentum venosum also it was vein and become obliterated. Vein which connect in fetal circulation also. Connect left portal vein with inferior vena cava in fetal circulation and become obliterated after birth and now become ligamentum venosum. So the teres, ligamentum teres, it was a vein, left umbilical vein, and ligamentum venosum vein in the embryo, it is called the ductus venosus. In the embryo, it's called ductus venosus, and obliterated and become vein and called the ligamentum venosum. Fissures of the liver, fissure for ligamentum teres and fissure for ligamentum venosum seen in diagram. Ligaments of the liver, peritoneal ligament or peritoneal folds related to the liver, falciform ligament, coronary ligament, right and left or upper and lower, upper coronary, lower coronary, or right and left, surround the bare area. Triangular ligaments, right and left triangular ligament. Also lesser omentum. Remember lesser omentum, which is a ligament connect the liver with the stomach. Falciform ligament. Fissures of the liver. Porta hepatis is a fissure. Porta hepatis, which is the hilum of the liver. Fissure for ligamentum venosum or fissure for ligamentum teres. In this diagram, this is the falciform ligament between the right lobe and left lobe. This is the bare area, non-covered by the peritoneum, related to the diaphragm. And this layer, upper layer of coronary ligament, and this layer, lower layer of the coronary ligament. From this side, extension to the wall, forming right triangular ligament, and extension of the peritoneum to this side, forming left triangular ligament. Left triangular, right triangular, upper coronary, lower coronary. And ligament attached between the liver and the stomach, lesser omentum. Also, this is fissure for ligamentum venosum, and this is a fissure for ligamentum teres, here. Venosum and teres. This is a lesser omentum between the liver and the lesser curvature. Liver and the porta hepatis and the fissure for ligamentum venosum. This is a lesser omentum. Non-peritoneal ligament. In this fissure, the fissure for ligamentum venosum present. In this fissure for ligamentum teres present. يبقى دي non-peritoneal ligament, ligamentum venosum and ligamentum teres. Bare area. Bare areas of the liver, areas non-covered by peritoneum. This is the large bare area between upper coronary and lower coronary. Bare area non-covered by peritoneum. This groove for inferior vena cava. The inferior vena cava present here, and the peritoneum covering the liver like this. So deep to the inferior vena cava, this area non-covered by peritoneum. Also, this is the gallbladder, with peritoneum covering the liver and the gallbladder like this. So deep to the gallbladder, and the gallbladder fossa is a bare area. The peritoneum surround the porta hepatis, non-covered the porta hepatis. So the porta hepatis itself is a bare area. Fissures for ligamentum venosum and teres will not enter inside the fissure, so inside the fissure, bare area. But bare areas of the liver, bare area of the liver between the two coronary ligaments, the large bare area. Fossa for the gallbladder, the groove for inferior vena cava, porta hepatis, and fissure for ligamentum venosum. This is bare areas of the liver. Relation of the liver. Usually, the most important relations of the posterior and inferior surface. From above the diaphragm, separate the liver from the pleura or lung above, and the heart will pericardium from above. And the costal margin, right and left costal margin, and anteroabdominal wall. This is the anterior relations. This is very important. The relations of posterior and inferior surface. Posterior surface, which is caudate lobe, groove for inferior vena cava, and the bare area. This part is called posterior surface. From the fissure for ligamentum venosum, this part is called the posterior surface. Fissure for ligamentum venosum, caudate lobe, groove 4 inferior cava, and the per area. And this is the inferior or visceral surface. This is the inferior or visceral surface. This large area related to the stomach. So this area called the gastric impression, gastric, stomach. But also in this area there are elevation of the liver, called omental tuberosity. This area after the stomach, duodenum, the first part of duodenum 2 inch. 1 inch related to this loop, which is quadrate loop, 1 inch, and the second inch related to the neck of the gallbladder. This is the first part of the duodenum, 1 inch related to the middle part of the caudate loop, and the second inch of the first part related to the neck of the gallbladder. First part of duodenum, then the second part. So this area related to the second part of duodenum. Transverse colon and colic friction. Transverse colon related to the lower border of the liver, especially at the quadrate loop. So the quadrate loop related to from below transverse colon. In the middle, el pylorus and the first inch of the first part of the duodenum, and above the lesser omentum. What is the relation of the quadrate loop? 1, 2, 3. Transverse colon, pylorus or first inch of the first part of the duodenum, and the lesser omentum. Colic fracture related into this area, colic fracture. In this area related to the kidney, renal impression. Above the renal, this is the suprarenal. And this is the bell area. Remember, at first, this is a gastric stomach, but also remember there are impressions in this area for the esophagus. So we must begin by esophageal notch, then gastric. After gastric, in pylorus to the quadrate and the first inch to the quadrate. The second inch of the is the neck of the gallbladder. Second part of duodenum related to the right loop, right colic fracture, renal and suprarenal. This is the relations of the visceral surface of the liver. Also remember there are groove for inferior vena cava. This is caudate loop. This is the caudate loop. This is the caudate loop. We have what is called the caudal process, projection of the caudal tail, caudal process, and also in the caudate loop there are elevation here called the papillary process. So the caudate loop liver have what is called the caudal process and the papillary process in the caudate loop. And this area, remember, related to the esophagus called esophageal notch. Again, in this diagram, this is the gastric area or gastric impression, and this area called esophageal area or esophageal notch. This is, remember, esophageal notch where this groove 4 or fissure 4 ligamentum venosum, and just to the left side, this is esophageal notch. Gastric elevation called tuber omental. After gastric, this is quadrate loop. The quadrate loop, this part related to the pylorus of the stomach, and the first inch, D1, first inch of the first part of duodenum. Also remember, this area related to the transverse colon, and this is lesser omentum. So what is the relation of the quadrate loop again? Transverse colon, pylorus, and the first part of the duodenum, and the lesser omentum. This is the gallbladder deep to the gallbladder fossa, and this area D2, second part duodenum, and this area colic flexure, renal, and the suprarenal. The caudate loop, this is the caudal process, and this is the papillary process. Caudal process, and this is group for inferior vena cava, and this is the bed area. This is fissure for ligamentum venosum, fissure for ligamentum teres. This is the caudate loop. This is groove for inferior vena cava, and this is a bare area. This is quadrate loop. This is a gallbladder fossa, and this is a hilum or porta hepatis. Impressions again. This area, number 1, esophagus. Number 1, esophageal notch. And this large area, gastric stomach. There are elevation here. This part called tuber omental. This is the quadrate loop related to 3 structures: transverse colon, pylorus, and first part of duodenum, and lesser omentum. 3 structures attached to colon. This is the gallbladder. After the gallbladder fossa, this area D2, second part of duodenum. In the lower area, in this area, right colic flexure. This area, kidney, renal, and suprarenal. This is the caudal process, and this is the papillary process of the caudate loop. This is impressions of the posterior and visceral or inferior surface. Structures in the porta hepatis of the liver. Vein or artery duct. Portal vein, most posterior. Portal vein. Usually, at the hilum, there are 2 openings for portal vein. Artery, hepatic artery. D, hepatic duct. Here. Portal vein most posterior, in the middle, an artery, hepatic duct. This arrangement inside the porta hepatis or inside the hilum. Later on, this structure descend in the free border of lesser omentum, and portal vein posterior, and the hepatic arterial duct anterior to the right and anterior to the left. This is the structures in the porta hepatis. Main structures in the porta hepatis of the liver. Porta hepatis site. It is a transverse slit or fissure on the posterior and the posterior part of the inferior surface. في posterior part of the inferior surface. الباوندريز. الكوديت لوب والكوادريت لوب caudate lobe والquadrate lobe. Structure passing through it, major structure, اللي هو three major structure, portal vein, hepatic artery, and two hepatic duct later on which form common hepatic duct. Two hepatic duct which later on form common hepatic duct, later on to form common bile duct. This is a major structure. Minor structures also present in the hilum or the porta hepatis, like hepatic plexus autonomic nerve fibers surround the hepatic artery, lymphatic vessels. Remember, the margin of the porta hepatis gives attachment to the lesser omentum. The margin of the porta hepatis gives attachment to the lesser omentum. Liver is a large or heavy organ present in the abdominal cavity. Why not the liver not descend by gravity? It is stable in its position. What is the factors responsible for stability of the liver in its position? At first, any organs in the abdomen stabilized by intra-abdominal pressure inside the abdomen. Yes, the ligament, the peritoneal ligament also stabilizes the liver. Surround organs or visceral also stabilize the liver. But the most important factor of stability of the liver is what? Two hepatic veins here. This is the inferior vena cava column, and this is the liver. Hepatic veins from left lobe or right lobe suspend the liver in the inferior vena cava. But hepatic veins is the most important factor of the stability of the liver in its position. The stability of the liver, hepatic veins, the most important factor. And inferior vena cava, hepatic veins suspend in the inferior vena cava. This is the most important factor. Triangular ligament and ligamentum teres will falsiform ligaments. The underlying viscera surrounding organs, intra-abdominal pressure, and the tool of the anterior abdominal wall. Lymphatic drainage of the liver, lymph vessels, superficial and deep lymph vessels, with lymph nodes. These lymph nodes, lateral diaphragmatic nodes, paracardiac nodes, hepatic nodes, and celiac nodes. When I ask you what is the blood supply of an organ, a blood supply meaning arterial supply. We mean arterial supply. I think the answer is artery, hepatic artery. Well, hepatic artery, hepatic artery. But in the liver, the hepatic artery only gives 25% of blood supply. 25% of the blood supply from hepatic artery. 75% from what? From portal vein. Portal vein gives 75% of supply of the liver. Why? Portal vein carry blood from GIT. The portal vein not enter direct to the inferior vena cava to general circulation, but the blood from the portal vein distributed to the liver and supplying the liver. Then later after supplying the liver, this blood drained by hepatic veins into inferior vena cava. So the portal vein supplying the liver by 75% of blood supply. This is the blood supply of the liver. Extrahepatic biliary system. What is the biliary system? The liver formed of cells of the liver, hepatocytes and so on, discussed in details in histology, right lobe and left lobe and so on. Inside the liver, there are what is called bile canaliculi inside the liver. Bile canaliculi. So this is called intrahepatic biliary system. The left lobe of the liver drain bile by what is called the left hepatic duct, والرايت lobe of the liver drain bile by right hepatic duct to form a common hepatic duct. الرايت hepatic duct drain bile of left lobe, والرايت hepatic duct drain bile from right lobe. Remember, there are another two lobes, lobe here called caudate, lobe here called quadrate. The bile of caudate and the quadrate lobe drain with the left lobe. So the function of the caudate and the quadrate with the left lobe. So functionally the caudate and the quadrate lobe is related to the left. يبقى هنا two hepatic duct form common hepatic duct. Then we have gallbladder, the gallbladder, and the duct of the gallbladder called the cystic duct. The cystic duct joining the common hepatic duct to form common bile duct. So the extrahepatic biliary system formed of two hepatic duct, common hepatic duct, gallbladder, cystic duct, and the common bile duct. But the intrahepatic biliary system discussed in details in histology. So in this lecture we discuss extrahepatic biliary system. But extrahepatic biliary system again, we have left hepatic duct, right hepatic duct, and common hepatic duct, gallbladder, cystic duct, common bile duct. Descend. Suppose this is the duodenum, first part of duodenum, second part of duodenum, and this is the remaining of the duodenum, common bile duct. Run D to the first part and joining another duct from pancreas called the main pancreatic duct and form dilatation called the ampulla of water, which open in the second part of the duodenum. This is the extrahepatic biliary system. What is the details of extrahepatic biliary system? Extrahepatic biliary system. Right and the left hepatic duct, right hepatic duct form a common hepatic duct. This is the gallbladder and this is the cystic duct joining the common hepatic duct to form a common bile duct. Common bile duct is joining the main pancreatic duct to form ampulla of water, which open in the second part of the duodenum. We begin by gallbladder. Site, the gallbladder present in a fossa in the liver called the gallbladder fossa in the right lobe. Size of the gallbladder from 3 to 4 inches long, means 3 to 4 inches, 1.5 inches wide, 1.5 inch in wide. It is pear-shaped. The capacity of the gallbladder اللي هو filling bile secretion about from 30 to 40 cc from bile. This is the gallbladder related to the transverse colon اللي هو الفندس of the gallbladder. The fundus of the gallbladder in this area project behind the inferior border of the liver and completely covered with the peritoneum. Anterior relations of the fundus of the gallbladder anterior abdominal wall with transverse column posterior to it. Surface anatomy angle between right costal margin and right linea similionaris. Linea similionaris, which is the lateral border of the rectus abdominis with the right costal margin. Body of the gallbladder related to the gallbladder fossa covered by peritoneum. Superiorly, it added to the gallbladder fossa and the liver. Inferiorly, it is related to the second part of the duodenum above, with beginning of transverse column below. Neck of the gallbladder. Remember, there are dilatation at the neck of the gallbladder, dilatation at the neck here, called Hartmann's pouch. Hartmann's in this dilatation called at the neck, called Hartmann's pouch. This area of Hartmann's pouch is a common site of a gallbladder stone, commonly present in the Hartmann's pouch. A neck, it is close to the Porta hepatis and continues with the cystic duct, may present dilatation called Hartmann's pouch, related to the first A part of the duodenum. Then cystic duct is S-shaped. Very important blood supply of the gallbladder, because common operation is removal of the gallbladder, cholecystectomy. Removal of the gallbladder or cholecystectomy. So we must know artery supplies the bladder must be ligated. Artery supplies is called cystic artery. What is the origin of the cystic artery? From right branch of the hepatic artery. Very important. Venous drainage by cystic vein drain into right branch of the portal vein. Nerve supply sympathetic and parasympathetic from the celiac ganglion and the anterior gastric nerve. Sensory from the right phrenic, with sensation from the right phrenic nerve. Duct system. Hepatic duct, right hepatic and left hepatic duct drain bile secretion from the liver. Common hepatic duct, then common bile duct. Common bile duct details very important of the common bile duct. Common bile duct divided into three parts: supraduodenal part, retroduodenal part, infraduodenal part. Part above the duodenum, part deep to the duodenum, retro, part below the duodenum, infraduodenal. The infraduodenal part may be called retropancreatic. Why? Because this part posterior to the head of pancreas. Again, this is common bile duct, supraduodenal, retroduodenal, infraduodenal or retropancreatic. The supraduodenal part present in the free border of lesser omentum. Free border of the lesser omentum. Remember, the free border of the lesser omentum containing three structures: portal vein posterior, hepatic artery and the bile duct anterior. Descend in the free border of the lesser omentum in front of the portal vein and on the right side of the hepatic artery. Right side of the hepatic artery. By hepatic artery, right to the hepatic artery, right side to the hepatic artery, is common bile duct. Retroduodenal part, retro behind, bus deep to the first part of duodenum. Infraduodenal or retropancreatic behind the head of pancreas here, in this area. In this area, the head of pancreas present here. Head of pancreas. So in cancer head of pancreas, again cancer of pancreas, compression of the common bile duct leading to jaundice. The early sign of cancer head of pancreas is jaundice. Cancer head of pancreas, early sign jaundice. Why? Because cancer head of pancreas compressing the common bile duct. Termination, the common bile duct joining the main pancreatic duct and form ampoule of water and surrounded by sphincter here, this muscle called sphincter of Oddi. Sphincter of Oddi surround this part and open in the second part of duodenum. Remember, in the opening of this opening, lower common bile duct and the pancreatic duct, separate the foregut from the midgut. Again, this is a gallbladder, and this is Hartmann's pouch. This is a neck. This is cystic duct, common bile duct with the main pancreatic duct form amber of butter and open in the second part of the duodenum. Now again, in the supraduodenal part present the supraduodenal part in the free border visceral omentum, posterior portal vein, and this is in the right side of hepatic artery. A retroduodenal part behind the first part of duodenum. Infraduodenal part or retropancreatic part deep to the head of pancreas.